So how many of you feel like your schedule at your practice is busy, but maybe it's full of the wrong type of patient? The patient who no-shows, who doesn't necessarily take all your recommendations, who doesn't tell their friends and family to come. That's what we're going to talk about today is the changing patient experience relative to marketing and how you can actually make some adjustments in what you're doing so that your practice is full, your staff is happier because they're not dealing with no-shows and upset patients, and you actually get to have the life you want and enjoy. So I've talked to a lot of you on the lifts and around here, and you're busy. You have plenty of patients, but let's get you the right ones. And so the biggest change today is we're going to cover is what is changing relative to patients' expectation with their healthcare practices. This is based in a study that we did at my marketing firm based on what do patients care about. So we surveyed patients and said, inside of healthcare, how do you choose a doctor? What makes you come back? What makes you leave? And then from there, what can we do to help you? And so we're going to talk about access to care, patient experience, and really understanding how the coordination between the front office, your actual treatment experience, and then follow-up can really lead to better patient experiences, but also better practices, better outcomes for everybody, right? So, and at the end of this, we'll have a framework that you can walk through, you can take back with you and say, okay, how do we actually audit this in our own practice? How do we make sure that we're doing what we're supposed to be doing? So let's talk about the modern patient experience. The hardest part is getting a good doctor who actually cares. So many doctors just rush through appointments and don't pay attention. I try to find good, qualified doctors who take the time to listen and care for their patients. Now, that sounds like a made-up quote, but it's actually from the survey. This is a free text response to a question about how do you pick a doctor? And this quote is what patients want from their doctors. Now, this survey is across healthcare. It's not specific to eye doctors, but it is the resounding theme of what patients want. They want doctors who care. And the good news is that almost every doctor I run into cares about patients. They want them to have better lives. They want them to be pain-free. They want to help them. And the system itself sometimes makes that complicated. But patients don't understand that. They don't understand billing codes. They don't understand that you need to double book time slots or triple book time slots because people no-show. They just understand that they're in pain. And when they show up, they want you to make sure that they're taking care of them. And so and for most patients, that actually turns into attention. They don't question that you're a good doctor. They don't question that you can help them. They question, do you care? And the great news is that everybody has the capacity to care, right? Not everybody can actually technically be a capable doctor. That requires a lot of intelligence and skill and dedication, but everyone can care. And so that's a good thing you get to change. So here are some numbers about how patients find care, how they choose care. 98% go online to find a doctor, right? They go online as a first step. I know a lot of you might be thinking, nope, we're all word of mouth. All of our patients tell us they get to us through word of mouth. Behaviorally, they might ask friends and family for referrals, but then the next step is they go Google you. They go look at your Google My Business reviews. They go look at your WebMD or your Vitals or wherever you're found. They go look at your website, and then they contact you, right? How many of you are sharing? I mean, most patients will not be sharing a doctor's phone number to contact, right? Unless it's some kind of inside baseball, hey, contact them this way. That's pretty rare. Most of the time, here's their name, they Google you. 23% of patients have switched doctors after a poor experience with the office staff. Most negative reviews, negative experience that are shared online are not about clinical care. It's not, I walked in and they didn't help me. I'm worse off. It's I walked in and they were rude to me. It's I walked in and no one paid attention. It's I walked in and it cost more than they told me on the phone. right? 86% of patients decide on a provider in a week. So the decision process is pretty quick. 67% switch doctors in the last 2 years. Now, that stat has to do with job changes, right? Most people's insurance, health and eye and dental is tied to their job. They switch jobs, they switch insurance. That also requires a whole new set of providers in their family. 65% avoid care due to unclear costs. They're not sure what it's going to cost. Inflation's up. The rise of consumer debt is higher. Credit card payments that are not being made higher. People's capacity for extra costs is very, very low. And then 62% say clear communication, funny one to fumble over, is why they stay, right? Expectations are clear. They know when to show up. They know what they're supposed to have. They know what's going to happen at their appointment. They know what happens afterwards. They know what costs. So the good news is all those are changeable. So this is what practices assume versus patients actually do, right? So on the left-hand side, we have common assumptions inside the industry. Patients will call us when they're ready. The reality is most patients don't call. They're going to search first. And if you want to talk about generational changes, who here has a child that is Gen Z or employees that are Gen Z? Which would be like 20 and under, 21, 22 and under. How many of them use a phone to call people? 0. If you ask a Gen Z to call somebody, they will look like you have asked them to go tackle a rattlesnake, right? They are scared of the phone. So, and the thing to know about that is caregiving generationally goes down a generation, right? So example, my parents are in their 70s. I'm helping them out with their healthcare. The millennial, Gen Z is who's going to be helping the next generation out or their grandparents out. And they're not going to call. They're going to expect to be able to communicate with you asynchronously, right? They want to text you. They want to email you. They want to contact you in a way that is not face-to-face and it's not real time. That says something about much larger than we can solve in this room, but it's still a norm. And the conversation we're having here is how do I help you guys understand what patients are saying in research, right? And you can choose to adapt it and do what you want with it. A lot of practices assume reputation is what brings patients in. Reputation matters, but then the online reviews are a big piece of that. Good care alone keeps patients to come back. It's not necessarily true. They switch because of constraints outside of their own world, right? So care is not enough. Patients understand how billing works. This is a major, major, major misconception. All of you guys in this room, including me, have something that we have the curse of knowledge. And the curse of knowledge is curse of knowledge defined is when you can't remember when you didn't know something, right? It happens in any kind of specialty, right? Because you've trained for years, you know all kinds of information that a patient would never know. That also applies to medical staff, right? Everyone in your office understands that medical billing is complicated, particularly in the ophthalmology side of things, right? Non-elective. Patients don't understand it. They do not understand that. If we wanted to right now, I could take my phone out, I could go to Carvana, I could pick out a car, I could buy it. I would know how much it costs. I would know when it'd be delivered. I know the color. In healthcare, you cannot do that. But the patient's expectation is, well, I can buy a car. I can know how much it's going to cost. And I know it's going to be delivered. How come you can't tell me how much my treatment's going to cost? And I know it's complicated. And we all know it's complicated because of billing and how billing works and insurance works and deductibles and all kinds of stuff. But for a patient, they don't understand all that. So we have to have empathy to understand how we communicate to them about that. And then also we have time to respond to new inquiries. Not necessarily. Patients are moving fast, right? The biggest trend that's happening is as patients pay for more of their own healthcare, they pay with more of their own dollars, they act like customers. So they want to be seen when they want to be seen. Actually, Randall and I were talking about that earlier. They want to be seen when they want to be seen. They care about convenience far more than they care about kind of basically your schedule, which is an inverse of the model. It used to be the opposite. The patients want to be seen when they want to be seen. And they will go someplace else because they also can't tell the difference, right? All of you are eye doctors. They have no idea how to evaluate you independently. So the one who's open and available is the one they'll go to soon. Now, some of you are in markets that are smaller or where there's less demand, high demand, less supply. That's a different model. But in markets where there's choice, they will go to where they can be seen. So where do they search? Insurance is a typical first place. Online search, online reviews, family members and friends, doctor finder websites like a WebMD, social media, and then even the growing trend is on what's called AI, SEO or GEO, generative search engine optimization, ChatGPT, Perplexity, Claude, those kinds of places. They're searching, not just where's the best doctor, but they're searching. And the typical search is, which is hard for your industry, is eye doctor near me, right? And a patient doesn't care and doesn't really know necessarily to search for an ophthalmologist or an optometrist, right? So it affects the ophthalmology practices more than optometrists, right? Because most ophthalmology practices are not going to be seeing a patient who just needs an eye exam, right? And so they receive a ton of intake relative to people who actually they can't help yet. They send them to the optometrist, right? Who then maybe refers them back to the ophthalmologist. But it still starts there. Eye doctor near me. Eye doctor open. Eye doctor accepting appointments, right? That type of phraseology. They may get into condition-specific, cataracts, glaucoma, contacts, LASIK, something like that. But typically speaking, they're going to start high level. So here are deciding factors and deal breakers, right? Accepts insurance, doctor's background and experience, 49% proximity, home or work, right? Again, convenience. Available appointment times, 40%. Poor online reviews is a deal breaker. Office is too far away, deal breaker. Bad referral or warning from someone I know, right? Typically, again, that's going to be about the staff, not about the doctor. And then long wait times for an appointment, 37%. They'll go someplace else. This is a good place to talk about this. The typical time that a patient wants to be seen is when they're not working. And this is there's going to be a big conflict here in the future, right? But the place that a patient wants to be seen is when they're not working. So most patients are working typically 8 to 5. So they want to be seen before 8, lunch, or after 5 or the weekends, right? When do none of you want to work? Before 8, lunchtime, after 5, or the weekends, right? And so that's a true constraint. So if you're looking for a opportunity in your area to be unique and kind of a marketing differentiator, early hours, late hours, and weekend hours can be an incredible difference maker because of the demand, right? Many patients, right, are hourly workers, right? They do waiting in your waiting room an extra hour actually costs them. A salaried employee, a little less different, a little more flexibility to their job typically, but an hourly worker who's taken off, maybe has to take off time to come to the doctor. Being seen when they're supposed to be seen is a big deal. It's a big deal. And again, they don't care about the fact that there have been 1,000 people before them that have no-showed. They want to be seen when they expect to be seen. So let's talk about the patient journey really quickly. Finding someone whose communication style, values, and availability align with my situation is difficult because a technically great doctor who doesn't listen or is hard to reach isn't very helpful. Patients want access. There's a report called the Barrel Report, talks about basically patient expectations in terms of a customer service. And the number one factor that has moved up the fastest is that patients want attention and they want to be heard. There's actually an interesting stat from that report that talks about the number one factor that a patient says that's basically not customer service is that they want their pain to be validated. So when they come to you and they're hurt, they want you to acknowledge that they're hurt. Even if there's not a medically good reason for them to have pain, their pain could be the fear of loss. Their pain could be the fear of not being able to watch their grandson hit his home run, right? The fear may not actually be, and the pain may not actually be physical pain, right? But they want to be affirmed in that. And the reason that's growing is because a lot of doctors don't acknowledge that, or they diminish that pain, They say, oh, it's not, you'd probably never say it's not a big deal, but you might inadvertently communicate that. And that patient has a lot of fear, a lot of anxiety around what's happening in their world, why they're coming to you in the first place. You see it every day. You know, you see 20, 30, 40, 50 patients a day sometimes, right? You hear a lot of the same story. To that patient, that's their one time with you, and that they want information and they want to be cared about. And so they want, and again, we're probably never going back to the world where patients have doctors' cell phone numbers, right? And we can text them unless you're in like direct primary care or something like that. But that's actually what patients want. They want access to you because they want to be helped. So if we walk through the modern patient journey, right, it starts with discovery. How do they get to you? Search, referrals, reviews. You can almost think of this as an invisible patient. There are hundreds of patients a month that you never talk to. You didn't have the opportunity to talk to because they hit your website or they hit your social media or they try to navigate to get care from you and they're unable to because they can't figure out how to book online or because they call and they get your staff isn't answering the phone at that time or it's whatever the meeting is, they don't get to you and so they move on to the next place. The best corollary for most medical professionals is, and this is important, you guys do not search for medical care the way a patient does. You would never search, you would never go to online reviews because you're doctors. And that's not how you would choose. No different, that's not how a lawyer isn't going to go to Clio, which is a lawyer writing website, and try to find that out, right? The best similarity is probably like how you might try to find a restaurant here this trip. You're going to go to Yelp, you're going to Google, you're going to go to Eater, you're going to try to figure out where should I go? What kind of restaurant is the best fit for me? So that happens well before they ever get to a touch point. That's the discovery phase. Then we get to access, right? This is one of the largest drivers that is another conflict point. Patients want to schedule online. They want to go to your website. They want to pick that they want to be seen next Thursday at 3:45, and they don't want to talk to you, and they just want to show up and be at that time. Most providers don't want any type of online scheduling. You want to have full, complete control of your schedule. And the problem is you lose out on patients who want the flexibility to make that on their own. We see this conflict in practice after practice after practice. So if that is a conflict in your practice, you're not alone. It's a very normal thing. But the growing trend is that patients want the ability to control their schedule because our lives are complicated. Patients' lives are complicated, right? There's sports and there's job conflict and there's all kinds of scenarios where they want to be able to make the schedule and then change the schedule. There's lots of really good reasons why you don't want to do it too. But again, we're not actually talking, this is the patient experience report, right? What do patients want from you? What's the patient of the future want? They want to be able to schedule. They want ease of scheduling, right? So as a tip, if you don't want to do online scheduling completely booked into your schedule, at least have some type of online form where they can fill out at a minimum name, contact information, kind of preferred date, preferred time, and the reason for the visit. We normally call that just a request to schedule. It doesn't work anywhere near as effectively as an actual online booking appointment, but at least it's an option for someone who is willing to kind of put themselves into the system. And then they want clarity. When do I show up? How do I show up? All those kinds of pieces. So then we get to pre-visit, step 3. And they need intake, they need instructions, they need expectations, right? Patients hate filling out the same information repeatedly. Fill it on the form, right? I recently hurt my hand. I went to an orthopedic walk-in clinic. I filled out my social security number on 12 pieces of paper. I'd already given it to them when I scheduled online, right? That is now I'm an N of 1, but that's every patient who walks through there. And again, there's reasons for it, but how do we fix that? What control do you have over that? Once you get to the front desk, again, they're at the office. They care about being treated like a person, greeted warmly, talked to with respect. It doesn't take a lot to do that, but maybe you wouldn't be surprised, but a lot of practices don't do that. You walk in and you're ignored. The person's on the phone. They don't make eye contact with you. They just kind of ignore you. That is not the starting point. Who in here is familiar with the term of the halo effect? Okay, so the halo effect is when we basically learn one thing, or we have one impression of somebody or something, and then we apply that kind of wrongly to the rest of that person or that experience, right? So if someone walks into and so why does a negative experience at the front desk matter? Because by the time they get to you, they already have a negative effect at your ability to take care of them. Because your front desk person couldn't smile at them. Because the halo effect is negative. This is a bad place. Because I was treated unkindly. Now, the opposite's true. You're treated nicely, they get to you, they expect you already, expectations I have. They already are anticipatory of it being a good experience. Even if you're having a bad day. They already believe it's going to be better. And it's an oversized effect. The same is also true of your website. Your website's easy to navigate. They believe that you're going to be, and your website looks modern and it looks clean and easy to, they go turn your phone and it works. They expect the whole office experience to be the same. Now, I know that doesn't necessarily make sense, but that is the psychology principle in practice. It is how it works. It's how we experience the world around us. Someone else who's here smarter than me could probably explain that, but that is how the science of that part works. So then they're with you, they get their treatment, and then they've got post-visit. What happens next, right? What kind of follow-up is there? What kind of check-in is there? What kind of next steps are there? Whether that's scheduling the next appointment, whether that's clear communication about their contacts or their glasses, or you're going to send them information on LASIK or PRK or whatever it is. Does that happen in a timely manner, in a way that they would expect? And then lastly, retention, right? Do they think you care? Do you ask for a review? Do you necessarily check back in on them? Do you have a programmatic way? Technology is great at this. Text message solutions, something tied into your EHR or EHM that will help make this happen. And each of these is an opportunity to either win or lose. Some of you are probably winning at some of them, but it's not just the appointment. So we just think it's just the appointment, it's just the appointment. It's more than that. So you go from website to phone and intake to in-office experience is how we work across. And one of the areas that is a trust killer is when the messaging doesn't match, right? Your website says you're open on Thursdays. They call on Thursday, not open. Oh, okay. That's confusing. That's frustrating. Long hold times, right? You call and you just get on hold, right? Again, most aren't going to call anyway, but if they are calling, they want to actually be able to talk to somebody. Or instructions that they receive in office are different than what they've received other places. So the inconsistency just signals disorganization. And the upside is that these are easy things to change, easy things to figure out. So, and here's the trust gap, right? 40% changed care plans due to bad reviews. They read a bad review and they say, I'm going someplace else. And again, it's not about clinical care. It's about how they're treated. 50% say a modern website's important. 84% check reviews, before they go to a new provider. Okay, so how could this affect patient care? Cost transparency, as much as possible, sharing with them what it's going to cost. I would guarantee if we called some of your offices and said, hey, I'm new to town. I need a pair, I'm starting to get, I think I'm getting older. I'm having trouble seeing. What does it cost for me to come in for an exam and potentially for glasses? And the true answer is it depends. Depends on all kinds of factors, right? Depends on the lenses they choose. It depends on the prescription. It depends on the frames. It depends on all their insurance, if they have insurance at all. But that answer isn't helpful to the person on the phone. So when they talk to you talk to the person, do you say it depends? Or do you give them a more helpful answer? That's, hey, it depends on lots of factors, but generally speaking, it's in this range. X dollar to X dollar. Same with scheduling friction, right? How long does it take to get an appointment? Some patients are willing to wait. A lot are not. And so, more than a couple weeks out, most patients are going to move on to something else. All right. To enhance my doctor's appointments, I would prefer shorter wait times and more flexible scheduling options. Having clear expectations of my health issues and comprehensive follow-up plan will help me feel informed and confident. Flexible and short. Again, it's about convenience. This is what patients are saying. Now, I'm not saying adapt your practice. I'm just saying be aware this is what patients want out of their medical healthcare experience with you. The good news is people stay for lots of really easy to fix reasons, right? They stay because there's easy online scheduling. They stay because there's a friendly office staff, because there's clear communication. They leave because they feel rushed during an appointment, because they didn't have availability of an appointment, or because it was too far away. This is at the top here is just a word map of a bunch of kind of patient feedback, right? What makes choosing a doctor hard? Time, wait, appointment, scheduling, location, costs, insurance, availability. What would you change about your appointment? Trust, time, reviews, comfortable, communication, care. Again, these are the number one factor, though, is it's kind of hard to read on the screen here, is 41% of patients say they would change the wait time. Trust, listening, and communication. They just don't want to wait. They want to be seen. Again, convenience. So what can you do about this? One, marketing is really communication and access. Visibility. Can patients find you? Two, can they get to you, right? Can they actually make appointments? Two, do they believe you and trust? So one of the ways to do that at scale that we've seen work with our clients is video, right? So you could, one of the things that all of you are excellent at is when you sit down with the patient and you explain a condition or explain what's going to happen next, you guys do a great job at that because you do it thousands of times. So recording a video of that and then sharing that with a patient via email, via text message, introductory wise, can really help build trust in a way that, again, that halo effect can really be very effective. And it doesn't have to be professionally edited or consumed. It doesn't have to be built on a $30,000 camera. You could do it on your iPhone and in Canva. But the step is that you're reaching out to the patient with who you are and what you care about. So here's the trust paradox. Most Americans are on social media, but trust overall is low. And 70% of internet users struggle to trust online content because of AI generation, right? We're not sure if it's real. But if you do educational video content that can demonstrate your expertise, if you provide introductory videos of yourself that can induce booking, if you can get patient stories and testimonials, that helps drive someone forward. All of you, again, wouldn't do this, but 35% choose a doctor based on your social media presence. 26% use AI tools to choose a provider last year, and 45% are swayed about responses to reviews. So are you responding to your reviews? This is where your patients are by generation. So on the left, we have Gen Z. Then in the middle, the darker is millennials. The yellow is Gen X. And then 65 is boomers. One of the interesting pieces of information we pulled out and have been using in our work is that boomers, so essentially your cataract generation, right, are all on YouTube. They consume YouTube content continually. Maybe it's because there's nothing else to do. Maybe it's because it's just an easy access point for them more than other tools. But YouTube is a massive tool for them. So getting content on YouTube can be very effective. We've seen it to be very effective at educating patients to move them forward and to just create a better experience when they get to the office. But you may want to look on that chart and figure out where are most of the patients that you see or want to be seeing, and how do you affect them? Where do you go? No, this doesn't mean that you need to become an Instagram influencer or anything like that. It doesn't even mean you need to use these tools personally, but it might mean your practice may need to start choosing to do some engagement on them, right? And here's the reality, is that not everyone in your office is actually doing this. The good news is that you've got a marketing team, which could be third party or in-house. You got a front office team, and you have your clinical team. Each of you has a role to play in that. And in most experiences, this clinical team side, which is you guys, are doing an excellent job. It's the other parts and pieces that are a little bit disconnected that create the effect that is complicated to patients and make them wonder, should I go here? Could I go here? And then lastly, of course, you need to be doing this within the guidelines of HIPAA and any kind of claims, right? You want to make sure you do that correctly. So what can you do about it? So here are the 5 key touch points that I would use as an audit if I came into you. I would start with the website. I would say, can patients determine if you treat them? Does it actually say that you could help them, right? The number one mistake that we see in patients or medical websites is when a patient comes to you and they sit down with you in your treatment room, what do they talk about? Do they say, I have glaucoma? Do they say symptoms? It's blurry. It's a little bit, I get dizzy sometimes. They start with symptom. How many of you on your websites talk about symptoms? If you're like most practices, very few, because you start with the treatments. You talk about providers, you talk about treatments. We have to connect the dot to patient language. They care about symptoms. And that's how they determine if you can help them, right? Phone and intake, is the phone answered? Scheduling, how can I schedule fast, friction-free? Are there clear instructions of what to do? And then post-visit, what kind of follow-up is there? The amount of patients who talk about the fact that someone followed up with them, right? They got a text from the team, they got a text from the doctor just checking in on them post-treatment. It moves mountains. And it can be automated, right? The patient doesn't need to know it's automated, but it can come across personal, but still be automated. And you can begin to walk through these pieces. And then these are the metrics, right? So if you're going to go to this practice or your practice manager and say, hey, let's make some improvements here. These are the metrics in the KPIs you could start to look at each of these areas, right? Instead of access, what's our new patient scheduling rate? What's time to first appointment? What's the utilization? Even call abandonment. Satisfaction scores, right? What's your post-visit look like? If you collect a net promoter score, complaint to compliment. By the way, this will almost always be negative, right? It's a lot easier to complain than it is to say someone did a good job. That's just human behavior. Retention, right? How many patients are coming back? Lapsed patients, reactivation. And then again, follow-up, right? How many people are coming back on the next visit when they're supposed to? Again, you're probably tracking some of these already, but if you're looking for an area to improve, right, these begin to track over time. Okay, so basically, these are the most common 4 scenarios that happen. A patient can't determine if you help them, a patient attempts to schedule but abandons due to friction, or they complete a visit, but they're not sure what to do next. And then lastly, they have a positive outcome, but they don't leave a review or a referral. These are the places where the biggest opportunity to improve your patient experience is based on what patients say they care about. Now, there may be other places in your practice to make changes. Most of you are probably thinking about adding new procedures, right? How do we kind of expand the market? Do we go to a different location? Do we add an associate? These are all really big questions. But in terms of what do patients expect, it's around these 4 areas. And the good news is that all of you have a chance to make changes to them. So again, if I was going to do this, if you're going to take this back, I would pick one of these touch points, pick one thing, and then evaluate it. Because of the curse's knowledge, you're going to have a hard time evaluating it. I would find a third party to evaluate it. That could be someone in your family, like a brother-in-law or a sister-in-law. Your mileage may vary exactly on that, but you find somebody who's not inside your exact network and have them call, have them try to schedule an appointment, have them look at your website, have them look at your social media and give you honest feedback. You can pay for a third party to do this. You can have a secret shopper. You could go through that process, but you can just start here and say, okay, great. What would a new patient experience here? And you can also, if you want to take it to the next level, we do this for some of our clients. We'll do it competitively. We'll call others in the area and figure out, is this something, where do we fit, right? And because sometimes you'll find out that maybe it's not as good as you'd like, but you're still better than the others around. That's great. You might also find out that others have a different system or a methodology that is working. And you can learn to adapt from them. So final takeaways, and we can do questions with whatever time's left, is transparency wins patients. Your digital presence is your front door. In the marketing space, we call it digital front door. It's this idea that your front door is now actually fully digital. It's your website. Communication drives retention, and the full patient journey is actually tied to marketing. It's not tied to just advertising or promotion. And being a good doctor isn't enough, unfortunately. It's the whole continuum that allows you to build a healthy, thriving practice that's got the patients in that you want, right? The ones that make your life an enjoyable practice, the ones that make your staff feel fulfilled, and the ones that actually drive the revenue and the work that you want. So I'm happy for questions or experiences of your own that are positive or negative. Yeah, in the back. Yeah, go for it. Yeah.
What's your recommendation of getting like robot clouds that are integrated so that they can find the avenues for the data?
Yeah, it's a great question. So the question was, AI can read websites. How do you basically get found on AI? And the shortest version of that is that AI cares a lot about answering a question. So are you answering questions on your website? So this kind of goes back to like the 90s almost of like FAQs, right? But making sure you've got questions, because most people's queries are questions, right? I was talking about this on the lift earlier, I think it was with Kristen. One of the hardest parts about AI in healthcare is that one of the things that AI does is it basically pulls together like a summarization of information, and that's often what can make it incorrect, right? So, and Google search is even doing this, it has been doing it for years and years and years, but now your first result return is going to be a summarization of information, and it can be inaccurate. We use AI in our work. We're big advocates of it. It's where search is going, particularly, and user behavior is going. But it starts with answering questions. One of the things that we've seen work really well for our clients to rank well in AI it's really not ranking, but to show up in AI searches is to have differentiators. And so the hard part is if your website is a template and it's a theme, it's exactly the same as every doctor around you, then you're not going to show up uniquely because you're not different. Now, you as a person are different, right? Your practice is probably different, but digitally, your footprint looks very similar. And so what we have found is when we were able to communicate, when the clients we have that their websites communicate clear differentiators, right? Whether that's how they think about solving the problem, whether that's a unique approach to solving the problem, their solution is actually medically different, then that actually is where the kind of the blue ocean space is for them to compete, right? So that's one way of doing it. But not the downside, but one of the parts of AI search that is questionable, is affecting us is search doesn't actually lead to links. So if you Google something, it's a link to your website. If we pulled up ChatGPT or Claude and we put in, best eye doctors, or actually more around conditions, you're going to get information, but you're not going to lead to a website. It's going to be pulled together. Yeah, Kristen. Yeah. So her question was, are there any retention strategies that work really, really well in optometry specific practices? And the best ones that we see work are, it goes back to a little bit what I talked about here, clear communication, follow-up. We'd automate the follow-up, right? We'd say automate the follow-up. The biggest issue that makes someone not come back is not the lack of care about their eyes, right? It's that life gets in the way, right? And so how do you overcome that friction of life got in the way, right? So whether that's, and some of that is where technology is really great, right? So if your front desk staff or your care coordinator is having to call somebody 13 times to get them to come back, at some point, Becky gets a little bit frustrated that she's calling this person again, right? Whereas technology at this point doesn't get frustrated. Now, and so the ability to kind of just, and so you can have an automated process that basically pushes someone to just general reminders to come back. Hey, don't forget to schedule. Hey, we've got openings tomorrow. Hey, whatever that would be. But that's what can get retention from like a actual booking side of it. The other side of it is, are there new, this gets a little bit tougher, but are there new opportunities for patients or cases specifically that that are now available that weren't before since the last time they came in. Now, again, at scale, that gets complicated because you're seeing hundreds and thousands of patients. But if you were able to say, hey, this is this is a good time to this new technology has come out, or we just found out about this new procedure that might help you, right? That's a reason, it's a catalyst for them to re-engage. Like you're reaching out to them, but that makes them feel cared about, that makes them feel heard, and then makes them likely to come back in. But again, it's a little bit tougher to do that. One of the funny parts about social media is if in our practices and the clients we work with, the posts that get the most engagement, Instagram Reels or on Facebook posts, are not, believe it or not, are not videos that explain some new treatment way of doing things, right? It's not the meeting that was just here beforehand, right? It is a picture of Jennifer saying it's Jennifer's 3rd anniversary here. It's Tina's birthday, because that's actually who the patients engage with, right? And they comment on that. They'll reply back and say, "Happy birthday, Tina," which it seems really silly, but again, it creates an awareness effect. It's actually easy to engage in. They're not going to engage in something that's related to eye care typically, right? Maybe frames, right? Maybe something that's kind of consumery. But new contacts that have come out isn't necessarily something that they get super excited about. But they can get excited about people. And so that's an easy way to keep them kind of in the ecosystem too. And it's very simple, right? Because everyone's got a birthday or anniversary or a life event that's happened. So good question. Yeah.
Or
Yeah.
one was there and receives on your steps.
Yeah.
Where are the forms? They're not actions, they're not description.
Yeah, that's a good question. So the question was this basically scenario 3. They come in and have a visit, but they receive unclear next steps. And where are we falling short? So I think it's one, there's not a clear, the decision's kind of being left to the patient potentially, like, hey, do you want to come back in? It's like, we just need very clear direction. Schedule an appointment in 3 months or in 2 months, or we need to see you next week or something like that. And where we see the gap in this is where the issue isn't like terribly acute, right? It's not like, hey, we need to see you Thursday. It's like, hey, sometime we need to monitor this over the next 3 months. And so that just creates it, kind of puts it into the ether. And then it happens, I think again, N of 1, I went into my primary care and he's like, hey, we need to see you back in a couple months. Well, that didn't make it into the chart, which then didn't make it to, I know he told me that. I could not tell you when I'm supposed to come back. It may be scheduled, it may be not. It probably hasn't been because it didn't make it all the way through the process, right? And maybe that's where in that process it falls is a question, but I think that's one of them. The second is patients. There's a lot of people are generally conflict adverse, right? And there's a lot of studies around doctors have authority. And I realize that in your world, you're getting patients who push back on you more and more. But if you're told, hey, you need to get these new glasses, these new frames, these new lenses, and they cost $2,000, the patient probably says, yeah, sure. And in their head, they're thinking, there's no way I'm going to pay $2,000. Like, I can't afford that. And so that also creates a gap of like, there's this assumption of affordability, even though that's not, or medical necessity that doesn't tie to affordability. And so how do you make that pathway cleaner or easier is a good one. And then I think really too, the last part about that is if it's, tied to scheduling, but again, it's who gets it? Is it, are they supposed to leave the office with something in their hand? Is it supposed to be an email? Is it a text message? What is when's that supposed to come? And then some of that too is also timeliness, right? Does it come 2 days later or does it come within the same kind of window? That's a good question. Yeah. Yeah.
Next time, but
Mhm.
so, question is, do you have any data on people that only want to schedule things online, people that don't want person-to-person communication?
Right.
Right? So is this the right person? I want him off. We're giving data on these people that only want to schedule things, don't want to talk to anybody.
Right.
Talk about five.
That's a good question. Yeah. So so the question was, is there any data on the retail side of eye care? And, how does that tie to someone who wants basically online accessibility, minimal engagement, essentially? And are they going to buy essentially retail from you? What? Say that again? Yeah. Yeah. So the way I'd answer that question is I don't have any data about that specifically. What I would say is what most patients want is to be cared about, right? So, and you need to identify the patients that you really care about. So there's an eye group in Atlanta, and I can't remember I was talking to their CEO, and there's a rise of Warby Parkers that were opening in Atlanta, right? Kind of in the outer ring. And they made the decision to be the anti-Warby Parker, right? So they had, I can't remember how many, it's an ophthalmology practice with ODs as well. And they were saying, you know what, we're not going to be Warby Parker, right? We're going to go after the patients who don't want Warby Parker, right? They don't want to order online. They want really great communication in office. They want to be seen by competent, caring, capable people and are willing to pay a premium over a Warby Parker or something else. And so I don't have any data on that, but his name was Ben, and Ben was saying that approach was working really, really great because the market, basically he was saying the market's large enough for people to buy online, and then and there's a ton of people who still want to actually be seen and cared for competently. Any other questions? Oh, one last one, and then Blake's going to pull me off with a rope.
Think all of that. Loyal is the right.
Yeah.
I picked the guy that I got me a pair of all that stuff for after we call it now 4 years right some guy really well and then he's like well we'll move a little bit of the one I find this well because I'm in a high competitive country.
Yep.
So he can go to a place to be. I know the guy. We do this thing together. I don't know down there. Expert. I want to let them get time.
It's a good question. I think what you're sharing, so the story was basically around how he saved a patient's eye over a 4-year time period, and then the patient moved and is now 10 minutes further away and now goes to a new doctor. And I think your story reflects actually what you're seeing in what patients care about, which is time and convenience more than necessarily the clinical care, right? Which is And so in terms of getting to the right patient isn't necessary. I realize that feels like the right patient. That's who you want to some degree to be your patient because of the time investment you've had. But the right patient in one sense is the one who, to the story earlier, right? If what you want is the retail patient who comes in and buys frames and glasses and contacts from you directly, then that is facilitating the relationships with those types of people. That guy is maybe the wrong patient, right? Which maybe isn't what you'd want to hear, but that might be say, yeah, because he's going to value his convenience and his time. Right. Yeah. And so that becomes the right fit, someone who cares about the relationship they have with you. And so I think, and there are patients that are going to be like that. They value the relationship over the convenience. And again, it goes back to determining which kind of patient, which kind of practice and patient do you really want? You want more of the relational patients, which often take more time. You know, they're lower friction on rescheduling, but then in office time, that person probably takes more time because they have relationship knowledge with you. And so that there's an aspect there too. So you could see it across the spectrum, is it the shortest version. All right. Yeah, yeah. Thank you guys.